Okay, my bill is on making healthcare more affordable and easier accessible for those who are still poor but not as poor. As you know, like many people lost their jobs during COVID, and so they don't have a steady income for them to be able to pay for healthcare. And according to the Commonwealth Fund, 43% of working adults are inadequately insured, with 9% having no insurance and the rest being underinsured, meaning that their insurance plans didn't provide them with affordable access to healthcare. Basically, what is being done is we would raise the minimum percentage of the poverty line to expand the Medicaid program to allow for more people to fit under it. For example, the mandatory requirement for Medicaid is for children through age 18 and families with income below 138% of the federal poverty line. So basically what would happen is I would raise the minimum percentage to 143 to advocate for more people, which allows for more people to qualify for Medicaid. And it also ensures that states also expand on their Medicaid eligibility requirements, which opens up for more people to have easier access to health care. For funding, you would just increase the federal share per state for Medicare by 5% to adequately cover the costs of the expansion of Medicaid. And that money would come from the federal, what's it called, like DODS funding. Does anyone have any questions? Yes.
No, Representative
No,
Cherray.
I lied.
Representative Barrett?
How many people would this affect? Like, how many people would this percentage raise and affect?
I have no clue. It's a 5% raise.
Mm-hmm.
So how many people fit under that 5%?
Representative Johnson?
So two things. One, so at the beginning you said like the people that were like poor but less poor. Can you please define what that means? Like what bracket are we looking at in terms of like how much money they make?
So these people don't fit under the federal poverty line now. However, they're still not making enough money to pay for their own health care. So it's like they're making barely enough money to live, but not to be able to like insure health care for like themselves and their families.
Okay. And then secondly, just you mentioned from COVID, like people losing their jobs.
Mm-hmm.
I mean, as COVID kind of becomes like much less of an issue, as you know, with like vaccine and stuff. As would this bill eventually like potentially be repealed or modified as more people are able to get jobs back? Or what are your thoughts on that?
I mean, I don't know. I think it's still important because there's still a lot of people who still don't have jobs and still don't make enough money from their jobs to be able to afford health care. And yeah.
Representative Kavanaugh?
What other implications would come from raising the poverty line?
I'm not sure.
Representative Oliveira?
What would be the effect on everyone else not including that poverty line? You say the money's coming from DODS, but they get their money from taxes, so how is that affecting us?
I don't know.
Representative Starin?
Is this just raising the poverty line for Medicare, or is it for?
It's just for the Medicare and Medicaid programs.